and I'm gonna help out with some stuff. Yeah, I'll be like turning off my camera and stuff.
Hi, Andrea. I'm glad you made it in. And hi, everyone. I see that our participants are starting to file in remotely, so we'll just give it another minute and then we'll get started. Thanks for being here. All right, we're at 12:06, so I think we will get started. I'm just going to ask the panelists to turn their cameras on now. You can stay muted if you want until we kind of get into our discussion. And I'm sure that as we continue, more participants will be filing in as well. So thank you all for being here. My name is Rebecca Fisher. I'm the Executive Director of New Yorkers Against Gun Violence. This program is part of our statewide education initiative called Connecting Communities to Prevent Gun Violence. We've been bringing together community leaders, survivors, elected officials at all levels of government, policy and public health experts across New York, and other healthcare professionals to discuss gun violence and the solutions that are saving lives. We're particularly committed to hosting regional forums like this one so that leaders and residents of specific regions of New York have the opportunity to discuss the gun violence crisis that's happening in their own communities, that's impacting our families, friends, and our neighbors, and to come together to support the solutions that are truly effective and working in our neighborhoods. New York State and local gun safety laws are some of the strongest in the country, and yet gun violence continues to be a public health crisis across our state. The COVID-19 pandemic led to a rise in gun sales and illegal gun trafficking into New York from weak gun law states. The pandemic also led to a surge in unemployment and poverty and deepened other systemic inequities in the poorest communities in New York State, including communities on Long Island. These factors combined with easy access to guns has caused a disproportionately impacted Black and Brown New Yorkers across the state, also in our Long Island communities. I think it's important to note that before and during the pandemic, gun violence has disproportionately impacted Black and Brown Americans, including New Yorkers, who are 10 times more likely than white Americans to be victims of gun homicide. Black Americans under the age of 25 are 18 times more likely than young white Americans to be victims of gun violence. And as we continue to talk about this crisis and to find the solutions that work, we need to be listening to Black and Brown communities and uplifting their voices in terms of determining what effective solutions are. According to the New York State's Division of Criminal Justice Services, the number of New Yorkers killed or injured by gun violence in 2021 has nearly doubled since 2019. This includes shootings involving injury in Hempstead Village, which doubled from 14 in 2019 to 28 in 2021. The same rates have been reported by the Nassau County Police Department and Suffolk County Police Department. In 2019, Suffolk County recorded 54 shooting incidents involving injury, and in 2021, 80 shooting-related injuries were reported. We cannot allow this violence to continue. Federal gun reforms continue to languish before the US Congress as Americans die every single day in this country. So New York State must continue to lead the way. And we need comprehensive solutions to tackle this complex epidemic. There's no one law, policy, or program that's going to end this crisis entirely. Lawmakers, community leaders, policymakers, and others have new proposals and plans to address gun violence and stop the shootings. We're hearing a broad range of ideas, some grounded in evidence and data, and some grounded in politics. So how do we address violence and public safety now while also ensuring justice and equity for all communities and survivors in New York? Which solutions are actually effective and which proposals should we be concerned about? To answer these questions and more, I'm extremely grateful that we're here today with experts and leaders who are at the forefront of the fields of public safety and criminal justice, and all working hard on solutions to address rising rates of gun violence on Long Island and across our state that hopefully will also influence other parts of the country. We have Dr. Satya, the Director of Gun Violence Prevention, the Director of the Gun Violence Prevention Center at Northwell Health. We have Rahsmia Zatar, Executive Director of Strong Youth. And we have Richard Paul, Lead Intervention Counselor for Strong Youth. And I'm looking forward to also sharing more of the latest legislative developments at the state level and New Yorkers Against Gun Violence advocacy priorities this legislative session in Albany. So let's start with you, Dr. Satya. I just want to jump right in. And I should also just say before we start the discussion that if folks who are participating in the Zoom webinar or on Facebook have any questions, please feel free to put them in the chat or the Q&A. We'll try to take maybe some of them as we're having this conversation. Otherwise, there'll be time at the end. So Dr. Satya, thank you again for being here. Tell us more about Northwell Health's Gun Violence Prevention Center and really what the focus of the work is that you're helping lead.
Absolutely. Well, Rebecca and the whole organization, thank you for putting this on and for continuing to allow us to have dialogue on this public health issue. And I'm really, really thrilled to be here with Strong Youth, who is just such a strong, really partner in the community that we at Northwell are looking forward to work with. So the center itself really kind of got started back in 2019 when our CEO, Michael Dowling, who was the CEO of Northwell Health, which is the largest health system here in New York, took a bold stance on this issue and said that gun violence is a public health crisis, and there's a lot that we need to do. So we really tried to sit down and say, what could we do as a healthcare industry, as a healthcare organization, and as healthcare providers to do our part to join organizations like Strong Youth that are really doing that hard work on the front lines to be able to make a difference when it comes to gun violence. So our whole mission is really focused on charting a public health approach to this crisis. What that means is really figuring out what works and what doesn't, looking at evidence, data, figuring out what those strategies are, how do we implement them, and how do we move them forward. We have a number of different work groups at the center centered around medical education, community outreach, screening, clinical integration, and advocacy. Each of those work groups does a variety of work. What I would say is that I think we'll touch on some of those initiatives as we delve more into the questions, but healthcare has a very unique role here. We've seen with other stigmatized health risk factors in the past, like HIV or substance use, that healthcare was able to lead the way forward in being a huge partner when it comes to destigmatizing those polarized topics, viewing them as a healthcare issue and making a difference. Because at the end of the day, we really do focus on this as a firearm safety or harm reduction type of issue. This is not about the Second Amendment. This is not about taking guns away. This is about making our community safer. So that's really what we're focused on. And I'm looking forward to diving into that a little bit more.
Thank you for that. I'm certainly interested in learning more as well. And I think it's really important especially for the Long Island community that, is supported by the Northwell Health System and the community groups that are surrounding it to hear more as well. In terms of your own, personal professional trajectory and your own expertise, I know that you are a pediatric surgeon, and I was wondering, how that has helped inform your role in leadership on behalf of the Gun Violence Prevention Center.
Yeah, I mean, it's the main reason that I'm so personally passionate about this. I trained in Chicago and even spending my time here in New York. We can't tell you how many times we have to treat children and babies with bullet wounds. It's actually pretty shocking. And having to tell those parents they've lost another loved one to a firearm injury that is largely preventable over and over again, how can we not care, right? This is really, when we talk about epidemics in this country, this is really something that faces all of our communities. And I'd like to, I think that's very important to understand. This faces all our communities. We know Black and Brown communities are much more affected when it comes to firearm-related homicide, but this also encompasses firearm-related suicide and unintentional injury, right? Which does affect a broad spectrum of communities. So really, we all have a part to play here, and this is right here in our backyard.
I think that that's absolutely true. And we all have a part to play in caring about each other, whether your own, backyard is being impacted or not. I think that that's really essential. And I think that it's also really essential, as New Yorkers, we're looking at suicide and also, inter-community violence as being really the primary gun violence crisis that we're dealing with here in New York State. And I think it's important as New Yorkers for us to turn our attention to those particular crises and find the solutions that are working there. And that actually kind of leads me to my next question, because I think as a country and, as New Yorkers, we're all always very concerned with regulating guns, which we should continue to do. And we have, and I will talk about, strengthening our laws and the roadblocks that we've continued to confront in Washington to get federal background checks passed and, to ban certain kinds of weapons like military style weapons and assault weapons. But I think that there has been a growing recognition that we need to be looking at this from a more comprehensive, holistic public health approach. And I think it would be helpful for our audience to hear why that's so essential, that not just one law or multiple laws, certainly in the immediate, are going to have the kind of impact that we need. Why do we need to look at this from a public health approach?
Well, I think you already really did mention this in that gun violence has, it's caused by a multitude of different issues, right? This is about social determinants of health. This is about access to healthcare. This is really multifactorial in its causes, and we really don't understand a lot of those yet. That's why I point to the public health approach, because we do need to do a lot of research on figuring out what are the exact risk factors. We of course know that there are certain risk factors right now, but what are the expansive, multitude of risk factors that are out there, and how do you mitigate those? We don't really have good data on that yet. So I think if you view this as a public health approach, by definition, you understand that this is something that has to be combated at multiple different levels. Policy, common sense policy, is of course a critical component of public health approach. It was used to reduce, motor vehicle injuries, right? Seatbelts, smoking. So common sense policy is a part of that, but it's just one piece of the public health approach. So there's a lot we can do. There's a lot we can do in healthcare. There's a lot we can do in the community to make our community safer. And I know we're going to dig into that a little bit more.
Yeah, absolutely. I mean, I think, when I get this question as well, I frequently think about how the reality is that we've been fighting for even just federal background checks nationally for decades now. And a lot of money and resources has been invested in that, initiative, and we need to keep doing it. But the fact is that that is not going to immediately remove the guns that are being trafficked into our neighborhoods. There's so many guns, in the streets, in the community, in the market. And so we need to simultaneously be investing more in other strategies that are impacting, our most marginalized communities. And I know that that's something that you may talk about more, and that Strong Youth may talk about more, but absolutely, like some of the high risk factors, of violence that we've even studied, at New Yorkers Against Gun Violence, are like housing, for example, and how the same communities that have historically been redlined actually correlates with the same communities that are most impacted by gun violence. And I think that we need to explore that research further. Is that something that the Gun Violence Prevention Center is doing? What kind of research are you specifically doing at the center?
Well, our research immediately is kind of focused more on the clinical setting, the healthcare setting. We are definitely intending to hopefully work with organizations like Strong Youth and so on to help evaluate some of the community interventions, because we're going to talk about shortly a hospital-based violence intervention program, right, which is really a bridge between a hospital and these community groups to be able to offer interventions at the point of care that can break the violence cycle. That is something we intend to absolutely study. But right now, the bulk of our studying, actually, our NIH research is focused on universal screening for firearm injury risk and intervention. So we're going to ask, we are already asking every patient who comes into Northwell emergency departments questions related to firearm injury risk. So those are questions related confidentially to firearm access, as well as violence risk, two different things. And if you screen positive on one of those, you'll then get an intervention. So if it's positive for firearm access, you might get gun locks, firearm safety counseling, and firearm safety courses in the community. If you screen positive for violence risk, that's where the HVIP or hospital-based violence intervention program comes in, and really the amazing work that Strong Youth and others are doing. That's where that is really, really important. Healthcare is just, it really has that ability to serve as that touch point to be able to make those connections.
Well, and I think that actually, very that segues smoothly into the next question of just the role of nurses and doctors and how that overlaps with the need for credibility, right? So, depending on who's asking the question of, do you have a firearm in your home, you could get a very different answer based on whether or not there's that trust that's been developed. So, what have you seen so far in terms of the receptiveness from patients to answering that question? And what has been the most successful there?
Yeah, so I think first of all, we studies in the past too have shown that the receptiveness is largely there. Most patients are actually quite receptive to being asked this issue. They're often surprised that it's brought up in the healthcare lane, but the real purpose here is to normalize the conversation around guns. It's a very stigmatized topic still, even in healthcare, where very few physicians or healthcare workers or nurses even talk to their patients about this issue, when really it is a safety issue. It is an injury prevention issue. So we talk to them about drowning avoidance, baby gates at home, smoking cessation, exercise. So we're looking to talk to them about firearm safety as well in the same light. And I think that's a unique thing that healthcare workers can do. We have a lot of work to do ourselves in normalizing this conversation. But I would say that that's kind of the biggest thing, Rebecca, that we're trying to achieve.
And what about just one follow-up question about that, because I'm sure that it comes up. There are folks who have gone into a brick and mortar gun dealer and purchased a gun and gone through a background check. And then there are other individuals who are buying guns on the street, and so they're considered illegal. And, there are obviously all kinds of ramifications to that. Though I do think that a lot of community members who are purchasing guns illegally are purchasing them for protection, and perhaps for the same reasons that someone is purchasing a gun, legally. And so from that perspective, we can talk about the data as to whether or not guns protect you, which all the data shows that they don't. But when the public perception is that they do, how do you address that in the healthcare setting? And is there confidentiality, given that it's a doctor asking, are you asking questions like, where did you purchase this? And is there any concern in some way that will be reported to law enforcement if the question is asked?
Yeah, great question. I mean, these are confidential questions, right? We already asked patients about drug use, suicide risk. These are the same confidential questions. So this is not about ownership. We really have to emphasize this, and not at all about ownership, legal or illegal. This is about mitigating factors. So, we work heavily, for example, with violence intervention organizations and gun owners, right? To have these credible messengers in the emergency department with us as we formulate this education, as we ask these questions. And patients are very, very receptive to this, because if you think about it in that lens, I mean, we're not saying take away guns, right? We're saying, how can we make that environment safer? And it's not always just about the gun, right? To point to what we talked about earlier, it's about a lot of these factors surrounding those communities, and how can we help create those bridges to CVI groups to really change that.
I, as the executive director of New Yorkers Against Gun Violence, really appreciate that perspective and that approach. I think that is essential to addressing this as a public health epidemic, and not stigmatizing or criminalizing certain patients that may be coming in, I think that when that bias is removed, you can have honest conversations about it, that is much more likely to ensure a much more positive result. And that lack of trust and the bias that, has been created in healthcare over time is part of the reason that, healthcare workers are not empowered to be able to be the protectors that they should be. So I'm so glad that Northwell, is leading on that. I want to ask you about hospital intervention strategies with community-based organizations, but I think I want to save that for Rahsmia next. So before we move on to you, I just wanted to ask Dr. Satya one more question, which is, specific to Long Island. We hear and read a lot about what's happening, in New York City, particularly in our most impacted neighborhoods in Queens and in the Bronx, and also in Brooklyn. And there's definitely been a similar spike in violence in Rochester, Buffalo, and Albany. What are you seeing on Long Island? I explained the data, the stats. So there has been a similar doubling, but what is the gun violence crisis on Long Island, and what should we be most concerned about there?
Yeah, I think just like you pointed out, I think the other panelists will give probably a much more front lines view of that. So I'm really interested to hear what they have to say. But just like the rest of the country, right, we're seeing spiking gun violence rates here on Long Island, and seeing spiking homicide rates, and seeing more and more kids in the hospital with gunshots. I think we've seen more in the last 3 months at Cohen's than we ever have in the last 5 years. We are also, remember, we're talking about firearm-related suicide and unintentional injury. And suicide continues to be the major driver of gun violence in this country. And Long Island has a very high firearm-related suicide rate. So, and that is largely from inadequately stored weapons, right, that are not secured and made safe. So others in the household, when they have an impulsive act, they can use that weapon. So yeah, no, this is absolutely something that's spiking in Long Island.
Thank you so much for your insight and your expertise. I'm sure that there will be more questions to follow up, and maybe I'll jump back to you at some point. But thank you for being here. Rahsmia, I'm so thrilled to move on to you. Thank you so much for being here. I would love for you to just share more about Strong Youth more generally, which has been so instrumental in helping reduce shootings on Long Island. Can you share a little bit more about that?
Thank you, Rebecca, for inviting me and Rich to be part of this conversation, critical conversation. I am literally, my heart is pumping because it's conversations just like this that we have, that why Strong was created in the first place, how Strong got started. I'm a lifelong Long Islander. Our founder, Sergio Argueta, is also a lifelong Long Islander. So this is an issue that is, personal. This is not just, a job that we went into. Strong's been around for about 21 years now. Sergio, the founder, started it, when he himself was at the pinnacle of, transitioning from street life, and figuring out that, he needed to do better for himself and better for the community, and that there were opportunities out there, but we were going to have to fight for it, that the opportunities afforded to communities of colors on Long Island are not as they are in our surrounding affluent communities. Just kind of jumping on what Dr. Satya said last, when you asked about what are we seeing on Long Island, the reality is that, again, Strong has been one of our primary missions throughout our last 21 years has been to bring attention to Long Island and have the broader, whether it's New York State or nationally, recognize that Long Island is a microcosm of what happens nationally. And we have this reputation of being, the white picket fence suburbs of New York City. And it's really important for everybody to realize that what we see on a state level, what we see in the boroughs many times is translating here. While we are the suburbs, Long Island is seeing very real urban type issues, especially, unfortunately, in communities of color, due to the segregation. And, we'll get into a lot of all the other factors. But Strong started, really with an advocacy organizing hat. Again, it was building awareness. We needed people to recognize that that the issue of violence, gun violence, Strong deals with gun violence, but we also deal with gang violence and youth violence in general. And, just being able to build awareness and support around being able to talk and bring resources around those issues to Long Island. And, we provide direct services. We have prevention-based programs where we partner with various school districts across Nassau and Suffolk County, as well as having community-based intervention teams that work more with the youth that are already involved in the criminal justice system or struggling and have some sort of street affiliation, street involvement. As executive director, my hat is in all aspects of it, doing policy advocacy, building out partnerships, but at the same time, making sure that our direct services are in line with what we know works, and that we stay true to the philosophies that we know really make sense and work in the communities that we focus on.
I actually think that is like, we'll move slowly into kind of the conversation around the models that work, right? That are being implemented and being followed in other communities that are disproportionately impacted in New York and across the country. Maybe some of our participants have heard the phrase cure violence or ceasefire, but really we've been more, generally talking about community violence intervention programs, and also hospital violence intervention programs, which I referenced in conversation with Dr. Satya. So can you just explain a little bit more, conceptually what is behind a community violence intervention program and why it's working? I mean, it's not theoretical. The data is showing that these types of approaches work. So what's behind that?
So first and foremost, one of the qualities that we have at Strong, and that I am very intentional about making sure that we maintain, is our grassroots, our on the ground connection with families and community. We cannot do this work if we are not partners with community. Unfortunately, there's a lot of groups that come into this work and really don't understand how to walk with community. It's a hierarchical type of relationship that is built, and we love to, and we know that it's necessary in order, to be able to have a very close, intimate relationship with the community. One of the things that we say always as Strong is that we're building extended families. We're building extended kinship relationships. We are very reluctant in calling ourselves even an organization. Rich can even talk about that when he talks about the work that he's doing directly with families. Our language is very intentional, and then our actions that follow that language have to align. So we have our intervention model is one that is holistic. Obviously, Strong has been around for a very long time, and we're still working with state and local officials and foundations to be able to fund the work in even a more comprehensive and holistic way. But as of now, we have mental health specialists. We create teams, and our youth and our families have access to these teams, and these teams are always in full communication of each other. And we have a mental health specialist, we have case managers, and we have intervention counselors, also known as credible messengers. I do want to point out that, and just focusing on the case management a little bit, because a lot of people have this idea of, case managers are there to connect to resources, which very much, our case managers do. But I think one of the most important things that our case managers do that distinguish them from other case managers in other populations and other areas, is that their big focus is the educational advocacy and criminal justice advocacy. And that comes from understanding that there is a real issue with those systems as far as the opportunities and the injury that occurs in those systems towards our kids that then lead to increased gun violence and youth violence. So our case managers really focus a lot on being able to advocate and bring successes, if, for lack of a better word, to our families in those, in those arenas and those systems. But and then there's the credible messenger piece that Rich will talk a little bit more about, what his day-to-day looks like.
Yeah, I really appreciate kind of like painting the picture of what, the organization does, because I think that there can be a perception or a misconception that, there needs to sort of be this top-down approach of, deterrence or threats or kind of scaring people into putting the guns down. When in reality, most of the approaches that are really working more broadly are providing support. And, one thing that and feel free to jump in at any point if you agree or disagree, Rahsmia, but one thing that I definitely want to clarify for our members and anyone listening in on social media is that, finding the right balance between talking about mental health as it connects to gun violence is really essential, right? So we don't want to stigmatize the community that has been diagnosed with mental illness. On the whole, folks with mental illness do not necessarily go on to commit a violent act, right? And so it's really important that we say that mental illness in and of itself is not an indicator of violence. However, on the other hand, those who've been impacted by gun violence and that trauma as victims and survivors of gun violence need more support, because most frequently those who commit a violent act have been a victim of violence themselves. And so when working in communities that it's possible that there are kids and community members that have not necessarily been shot themselves or have, or don't even have a family member necessarily who has been, shot, but they are impacted still. It reverberates through the community in many different ways, whether it's the loss of a family member or, intergenerational trauma around violence, or hearing shootings in your neighborhood, or walking into your school with metal detectors because the school assumes that you are going to have a violent weapon on you and that you are sort of criminalized. Walking into your school, you talk about the systems, not working for our students. And I think that that's definitely a piece of it. The school to prison pipeline element of it, that the kids are, instead of being supported, they're frequently pushed out of their schools. And then what support do they have? And so even though we want to talk about mental health carefully, having mental health support for those folks in the community who are most traumatized is such an essential piece of this. I hope it's okay that I just jumped in with that, but, I wanted to clarify that piece.
Absolutely. I just want to also add that, again, we are very cautious with the language we use. And I say mental health specialists because it's what, the broader society is going to understand. A lot of the work that Strong has engaged in the past few years really has been around this idea of healing in general, right? And we talk about, being victims of violence and being of tangible, actual violence. But a lot of what we are trying to recognize is that, and you just mentioned intergenerational trauma, we're talking about systemic violence, right? And the impact of all of that. And, no matter what type of exposure you have to violence, our communities are in dire need of true healing. And we've partnered with an organization now based in San Jose, California. We actually were recently named, appointed their Northeast Regional hub. They're called the National Compadres Network, and a lot of their work is around providing healing processes to our communities, to our youth and their families, from a very cultural based, recognizing the strengths and resiliency of, ancestry and what we carry. It's a very strength-based perspective, and how that has to do with gun violence, since we talk about, and there's that saying, hurt people hurt people. So in recognizing, the trauma and the injuries that have been done to our communities for generations and continue to be done on a daily basis through institutional violence, it is important for us to make sure that we're providing those healing spaces, and in a way that really speaks to our, that is in us, that speaks to us. And it has been, the work that we've engaged in as far as healing has been so astronomically successful. Again, it's kind of expanding on social work practice, and bringing in more tools that are just more culturally relevant. And we've seen how successful, and we've seen the positive impact of that, and the response, from our kids, from our families, in this type of approach has been amazing.
I think that that's such an important way of framing it, from a healing perspective, especially as hopefully, more members of society are understanding how important just mental health counseling is in general, and that that's actually a healthy thing to do. Seeking out therapy is something a healthy person does, and holding it all inside is unhealthy, right? I was actually just talking about this with my own children. And one of the ways that also I think it's important to frame it, and you touched on it, and I hope Rich will too, is that, right now we've all been going through this trauma of COVID-19 and the pandemic. And so many more people are seeking out support. But if you've already experienced so much trauma, and you're living in a community that experiences trauma every day, that may be suffering from poverty, and is encountering other struggles, like racial injustice, you pile on all the stresses that everyone is experiencing in society right now. That's going to take a whole other level of healing and credible healing in order to provide that support. And so, I think I'm going to keep using that word. I think that's really essential. One last question for you, because I definitely want to give Rich as much airtime as possible. I really want to hear from you, Rich. Is just talking about why it's so important that groups like Strong Youth work with Northwell on like a hospital intervention strategy program. How can the community group come in, and when is that most essential?
I mean, as I sat here hearing Dr. Satya talk about, his expertise and where the hospital system is coming in, it just reemphasizes and reinforces my perspective that this is a very complex issue, the root issues, from root issues to solutions, right? And there's not going to be any one group or organization or institution that is going to be able to solve this. This is an all hands on deck, time and issue. Strong Youth, definitely, we have our fortes, we have our line of expertise, we have our experience, and I have no problem granting the space to other individuals that bring in added perspective. And at the end, it is this exchange of expertise and this willingness to come together, and recognize the lanes that we all are playing in, and then how do we engage those lanes to work together. This is a complex issue, and if there's anybody that thinks that there's going to be one person or one particular group that's going to solve it, they couldn't be more far from wrong. At the end, I am so excited, whenever I'm approached by people in different, in different areas willing to address this issue with us. And I know that at the end, it's our unity, it's our collaboration, our willingness to collaborate and respect each other's expertise and what we bring to the table that's gonna be able to make our mission possible, make our vision possible. And so I definitely am really excited. As Dr. Satya had mentioned, we're in conversations, about how we can continue to build out. I know that that New York State has started to put a focus, on this issue of violence. I'm looking forward to engaging New York State in a very intentional conversation about what that looks like. But I'm really excited that, some of the pieces are really starting to fall together, especially in the realm of partnering and partnerships and, players coming together.
Well, that sounds fantastic to me. First of all, I should just say, as an advocacy organization, anything that we can do to partner with you to advocate for more funding, we want to do. That's been part of our advocacy initiative, is to lobby for more funding at the state and local level, also to get it from your, local government, to invest more in community-based solutions and hospital-based solutions. And one other thing I was going to say in response is, because we worked with the hospital intervention program in Brooklyn, is that one area where credible messengers have been very effective is at preventing retaliation. That, someone will be shot in the community and brought into an ER, and the family members and friends will rush into the ER with them and ask, who did this to you? And, because there is such a low rate of crimes being solved in those communities, that law enforcement isn't necessarily trusted to find the remedy or to bring folks to justice. Community members, especially in that moment, will take it into their own hands. And so if there's a credible messenger on site or available to help de-escalate that situation, to prevent that retaliation, that is a very effective way of doing it, as opposed to necessarily like a healthcare worker who might be on site but doesn't have that relationship to be able to say, no, let's not do this. Let's stop this cycle right now. Thank you, Rahsmia, so much. Hopefully there'll be some more questions for you too, but now I really want to turn to Rich. Rich, I'm so excited to have you here. It's so nice to meet you. I'm really looking forward to working with you more too. Would love to hear more about what your role is at Strong Youth and what you do as a lead intervention counselor. So welcome.
Absolutely, absolutely. Thank you for having me here. I'm honored. As you mentioned, my name is Richard Paul, and I am the lead intervention counselor for Strong Youth's Nassau University Intervention Program. I would like to start off by saying that the youth that I work with, very respectful, very intelligent, right? And they have a world of potential, but unfortunately, they don't have a world of people around them that believe in them enough to invest in them, right? With that being said, the youth that I work with are also, gang involved, street involved, and they've also, for the most part, been involved with the criminal justice system, right? A lot of our youth have experienced gun violence on a day-to-day basis from multiple perceptions and positions, perceptions being the ways that they view them and positions being the ways that they experience them. As a part of my role as intervention counselor, I challenge the destructive mind frames and ideologies that some of our youth carry that stem from the streets, mind frames and ideologies that I once carried myself, right? These are also the ideologies that are the foundation of the thoughts that come before, during, or after certain acts of violence. Our whole intervention groups and mentoring groups, trips and events with our youth to expose them to new things outside of their communities. We hold individual sessions, and I have heart-to-heart real talks and conversations with them. But if you really want to know what I do on a day-to-day, I show up. I take kids to school that haven't been to school in 6 months because I'm knocking at their door at 6:45 in the morning like this with a breakfast sandwich in one hand and orange juice in the other. I show up. A lot of our youth may be overwhelmed and make rash decisions, right? For example, they may leave home. In those times, the only thing that they're doing is making decisions that all teenagers make, right? When they think they know everything and they have everything figured out, until it gets to that moment when they realize that they may be in over their heads and they don't know who to call, they call me, right? And I show up. Night, day, middle of the night, morning. In those times, as you mentioned, where our youth may not know how to handle a certain conflict on the streets because either they've been shot or somebody close to them has been shot, and all of the voices around them may possibly be misinformed, and they're informing them to go retaliate, right, or go take revenge. I show up and I explain to them, like, listen, I've been in that same situation that you're in right now, and I made that same bad decision that these people around you are telling you to make. It's other ways for you to support your friends, right? It's other ways for you to defend your quote unquote reputation in a positive light. But most importantly, I show up every day. I show up whether I'm on the clock or I'm not. There is no clock. I do what unfortunately our society does not. I show our youth that they are worthy, and I show our youth that they have support consistently every day.
I think that that's, first of all, just so admirable and incredible because you're also inserting yourself into situations that are probably traumatic to you and triggering for you, just given your own, experience. And I can also see why you understanding that and your experience, in the streets yourself is going to provide that credibility and that trust that young people are going to feel when you show up. As opposed to someone that's unfamiliar to them or someone who's a uniformed law enforcement officer. Like that's not going to be the trusting partner that they need in that moment. I see a good question actually in the chat, but I wanted to ask one other question first. We have a program in New York City public schools, and it's one that I know Rahsmia and I have talked about maybe partnering in schools too, and also taught by credible messengers as well, and, in terms of our instructors. And one question that our director of education always asks young people directly is, why do young people pick up guns? And how does that relate to hope and power and hopelessness and powerlessness? Why is it that young people are picking up guns? And I think, I've heard a lot of answers, but I think it would be important for our audience to hear that from you.
No, absolutely. Our young people need something to believe in, and they need people to believe in them, right? So what do we do when we see a stock that we believed in? We invest in it. What do we do when we find a prime piece of real estate that we believe will flourish in the future? We invest in it. A lot of our times with our young people, nobody is investing in them. It's symptom versus problem. We talk about gun violence, gun violence, gun violence. Absolutely, gun violence is like let's talk about it. But gun violence is the symptom. Gun violence is the symptom. It's not the problem. We're dealing with a core root of issues that seem to be neglected by our society, right? And our young people. We don't give our young people anything to believe in, right? We don't give our young people anything to dedicate themselves to. So when they find something to believe in on the streets, then all of a sudden we turn around and now it's an issue. Right now it's a problem. Gangs, gun violence, like gangs are a natural formation to system failure. We're not giving our young people anything to believe in, right? So I think I really believe it's an issue of symptom versus problem when we talk about gun violence, opposed to the issues that are really, really, really affecting our youth on a day-to-day basis and the level of support that they have, right? So when we invest in when we ask these questions and we invest in approximately $70,000 to house New York State prisoners, right? To give them their basic needs, right? But we won't turn around and invest that same money in our youth and in these Black and brown communities before they reach the prison system. I think this is a major issue, right? So when we asking these questions about gun violence, the symptom versus problem, what are we doing to invest in our young people so their futures will be promising, but also so they can believe and know, understand that they have a future, right? What are we giving our young people to believe in?
I appreciate that, receive that. And that's definitely so much a part of the vision of New Yorkers Against Gun Violence as well. And why we have to talk about these systemic failures, in addition to kind of the response that we have, right? If law enforcement are showing up, or even if community violence intervention workers are showing up, that's a response, right? That's the end of the cycle. That's the outcome, the gun violence, right? And so why did we get to that point? Where has that investment failed us? And I think, that's why we need to be talking more about advocating for policies that provide support in housing and provide support in schools, because those are also prevention policies to prevent gun violence. So thank you for that. We did get a question in the chat that I think is important, which is, how do you find the young people that need your support? How do you recruit them? How do you know where they are, where the hotspots are? How is that, part of your job?
Absolutely. To answer the first question, how do I know where the hotspots are? I'm from this community. I'm born and raised. I know the hotspots. I've walked the hotspots. I've experienced the hotspots. I've done the same thing that the young people have done in the hotspots before they've done that, before they've been there. But also I'm in tune. I'm in tune with the community also, right? Like I build with the community. Have relationships with members of the community, and they feel comfortable talking not only to me but to us, our whole team, intervention case managers, as well as our mental health specialists. Rahsmia Zatar is our executive director, but you see her out here mingling, talking, building with the community at any given moment, right? So it's really community. It's community based, and we interact with the community. Now you mentioned referrals. We are referral based, so we get referrals from schools, sometimes probation officers, and we on the ground. So I might have a youth that I'm working with. He may be involved, and through him, right? I'm going to his house. I'm going to his building. I'm playing basketball in his community, right? So after building with him, I may meet some of his friends. A lot of our youth often introduce me to their friend. Oh, what's up? This is Rich, and I build with them as well, right? So we're referral based, but also we on the streets, we on the ground, and we connecting with the young people in a positive way. We connecting with the communities. They can see us. I got my strong hoodie on, got my strong jacket on, so they know who I am. But also, when you see somebody on a regular basis, it's one thing to come into a community one day. Oh, hi, I'm here. How you doing? Let's set up a table, right? Like we see happen a lot of the time. We're gonna set up a table. We're gonna make a big announcement. We're gonna be here. We're in the community, and then after these 6 months, we're not here no more, right? For the rest of the year, we're not here anymore, right? So we're there every day, home visits every week, right? Activities every week, events, as much as we can, groups every week, right? Tomorrow, I'm proud to announce that we'll be having a panel, right, that speaks to the same issues that we're speaking to for the next 3 Tuesdays leading up to our youth conference, our Breaking the Cycle and Gun Violence Youth Conference on March 26th. And it's things like this, constant engagement with the community in a positive way to let them know that we for real, we're not the same. Don't compare us to certain individuals who may be here today and going tomorrow. We're here to stay because we're a part of this community as we work with this community.
Exactly.
If that answers your question.
It does. And, I'm seeing questions in the chat or comments in the chat about, how incredible you are, which you are. And I think that, if anything, it's just a testament to what Rahsmia said, which is we need more resources because you're one person and you can't carry the whole community on your back, right? And we need to have as many folks on the ground as possible to be able to do all of this work because it's so much work. You're wearing like 25 different hats and you're putting your own life at risk. Let's be honest, right? Like you're going into some of the areas and some of the, in the middle of a crisis. So there needs to be more investment in that. There needs to be more resources. in programs like yours so that more folks can be hired and so that, the people who are doing the work on the ground are getting paid appropriately too. And so that is definitely something that we will continue to advocate for, because I know, and I say this, I think you'll appreciate this too, there are so many great people like Rahsmia, like Rich, like Dr. Satya, who are ready to go out and do this work. And we just need the funding in order to have that happen, right? This is not exceptional. This is the reason that it's so exceptional is because we don't have enough money to be able to make this happen in a more widespread way. So I definitely am advocating for that on behalf of Strong Youth, on behalf of Northwell, on behalf of New Yorkers Against Gun Violence, and just CVI, type strategies in general. We need more of that. One question that I saw that came up that's specifically for Rich, and then maybe I can answer some of these questions about ghost guns and illegal guns, and just in the last few minutes kind of parlay into some of the policy and how that interacts with what you're talking about, is for you, your own personal narrative, what led you to kind of end up where you are, which I can gather in part is from your own experience, but what caused that shift? And was there one or two influences on you in particular that helped you get to where you are now?
Absolutely. Thank you for the question. For me, in a small group, out of a small group of my friends, right? It's more, but if I just add up the numbers, for me in my very immediate circle, small group of my friends, collectively, we were sentenced to a total of 93 years in prison. 13 and a half of those years were mine, right? So outside of my mother, there weren't many adults that came into my life, stayed in my life, and supported me, right? And believed in me, right? And nourished my soul, right? And constantly told me, not only constantly told me that they believed in me, but they showed me day to day, right? So something that I'm not sure if you know or you don't know, or if our audience knows, I'm not sure if our audience knows, but prior to me being the intervention counselor here at Strong Youth, I was once a program participant, right? So my mentor was the founder of our organization, Sergio Argueta, and Rahsmia Zatar, right? So it was times where we had amazing talks, and I still went back out to the streets, and I found myself in unfortunate situations, and they didn't give up on me, right? It's like having people that truly care about you and will truly dedicate their time, their health, their minds, their hearts, their souls, and invest that into another person. They invested that into me. So that was a major part. That was a major part of my transition and my transformation. They planted seeds in the garden. That was my mind, where even though they didn't immediately sprout, when the time was ready and when I was in an environment that was able to nourish these seeds, I never ever forgot the things that they taught me, right? And I went on that. I use those tools to go on a healing process, a healing journey, and I think that's very important. And I heard you mention, the need for credible messengers and the need for for us to invest in credible messengers, in individuals like myself who are out there who are willing to do the work. But a big part of that is that I took time to myself to heal and process the things that I've been through. They assisted me in healing and processing the things that that I've had to experience that I once normalized. And I actually think that's an issue because, especially on Long Island, when we talk about credible messengers, that's very important. But also we need these, right? We need these services, these re-entry services, right? That support people when they come home. And New York City is more progressive than Long Island. So they have these, at least they have more than us. They have these organizations, Osborne, Exodus, Fortune Society, Ready, Willing, and Able, that invest in returning citizens, male and female, that come home, need support, need somewhere to live, need a job, right? Like Michelle Alexander speaks of in her book, when you come home, it's like it's like you're still incarcerated, right? Like we still going through these experiences. I came home with a college degree, but still I'm having problems getting a routine job at Home Depot or CVS just because I have these felonies on my record, right? I had issues while I'm out here doing the work. While I'm out here doing this work with Strong for the community, day in and day out, I'm still having issues trying to get a second job. They don't know that I'm doing this work, and I'm dedicating, myself to the community as the community has dedicated itself to me. But I still have these issues getting employment. It just so happened that I am at Strong Youth. But what about the individual who hasn't? What about the individual who hasn't had the opportunity to process their past experiences and traumas and these different ways of thinking? Like, where's the support for them? Where's the investment in them, right? In order to invest in our youth, in order to truly invest in gun violence, we have to invest in our people. We have to invest in our returning citizens who are coming home, so they can be prepared mentally and emotionally and physically to carry that weight and support our youth. So I think that's a major thing, and I had that, right? I had the opportunity to have that, right? So to answer, take it back to your question, that was a part of my journey that led me to this point today. But I believe that's something very important that we need to advocate for more real adequate re-entry services on Long Island, so we can create these and build up our credible messengers.
You just said so many things that I want to respond to, because everything you said is so important. I mean, first of all, just having the conversation about what's happening on Long Island and really distinguishing between how different communities are impacted, both from a credible messenger perspective, like if you grow up in the Bronx or you grow up in Hempstead, like that's a very different experience, and people who know you in the neighborhood, etc. Like you need to have that credibility really in the neighborhood growing up on Long Island, right? And what you face there. So there's that. And then there's in terms of like the receptiveness to reentry and the relationship with law enforcement and how the schools are, and also just in general how segregated Long Island is, right? Like how the communities are so blocked off. There isn't nearly as much interconnection, both in like the educational system and in terms of the economy. Speaking of the economy, like I think one of the most important things that you said is just talking about what that looks like in terms of job reentry. And there's actually legislation pending at the state level right now that you should be able to remove that criminal record from when you apply for a job. You should not have to disclose that. And why? Once you have served your sentence, you have served your sentence. You should not have to continue to serve another life sentence out in the world once you have done that time, whether that time was just or not. Once you are out, you should be able to get a job just like anyone else. And we're failing, our communities, we're failing our society by continuing to imprison folks, in the way that we are, by not allowing anyone to reintegrate into the economy and get a job and support their families. And part of that is what contributes to the cycle of violence, because often people get caught up in violence because they're trying to make money. And that's what leads to, some violent interaction with another group or another individual because of those transactions that they're just trying to support their families. And I think that we need to humanize that, and you do such a wonderful job of doing that. Thank you for sharing your own personal experience, because that is really hard and really private. So I appreciate you being able to talk about that with so much transparency. There's so much more. I feel like this is just the beginning of the conversation, and we're at 1:07. I did want to just briefly touch on some of the questions in the chat about ghost guns, and also talk about how that relates to, what we're talking about here. So last session in New York State, we passed a state law that bans the creation of ghost guns, which are unserialized, untraceable ghost guns, homemade guns that you can buy pieces online and create in your own home or with 3D printer, and unfinished receivers, which are basically like the major component of a gun, have to be serialized too. However, just like the same issue that we have across the board in our country, which is that we're strengthening our state laws. We're prohibiting ghost guns from being created in the state. But the majority of guns that are being trafficked into our neighborhoods that are creating all of these shootings and that are leading to so much devastation are from out of state. In fact, over 75% of the crime guns that are recovered in New York State that are being used in shootings are coming from weak gun law states. And so until we continue to pursue solutions to regulate the trafficking of guns into our communities, we are going to have to continue to provide the support that we're providing because those guns are going to be there. There's also that question of like, why are those guns there, right? Yes, there's a demand, but the supply is such an important piece that we need to address, right? This is not by accident. It is not by accident that guns are being trafficked into our most vulnerable communities where we have young people who already feel vulnerable, who already feel powerless, right? Who already feel like they need something to protect themselves. That is deliberate. It is deliberate. It's deliberately a part of the system that has been created by gun dealers, down the iron pipeline, and gun manufacturing companies that want to continue these guns into circulation because they're benefiting and they're profiting. And that's also one of the reasons why last session we supported and advocated for a first in the nation law that allows New Yorkers and the Attorney General to sue out-of-state gun dealers for reckless and rogue practices that are leading to this trafficking. So if an out-of-state gun dealer is irresponsibly selling over and over again to someone that they know is then going to sell those guns in mass quantity to a straw purchaser and then traffic those guns up the iron pipeline in the back of a truck to Hempstead, then a victim of gun violence in New York or the AG can actually file a lawsuit against that gun dealer. And that is something that's a huge priority to New Yorkers against gun violence, is really going after the high drivers of crime, right? Not criminalizing and focusing all of our energy on the last chain, right? The last individual who's picking up the gun, but also who are the highest suppliers of guns. And finally, the two top priorities that we are advocating for at the state level this session, and I would love Strong Youth to be involved in this in some way, Northwell to be involved in this some way, and I actually think, Rich, you should get involved in the Clean Slate campaign because that's exactly what you're talking about job reentry and being able to get a job without having to serve your sentence again. The two gun violence prevention policies that we are advocating for are microstamping legislation that would improve tracing because it would essentially require dealers to put microstamping technology into every firearm that is sold in the state of New York to stamp an alphanumeric code on a cartridge casing so that guns can be traced back to the gun dealer. And this would ensure accountability of the dealers that are selling these guns. That's always, again, what we're trying to ensure. We're trying to penalize and hold accountable the gun dealers. And then the other legislation that we're advocating for at the state level is called the Fair Access to Victims' Compensation legislation. And I will just briefly explain this. So right now in the state of New York, there is funding for individuals who are victims of crime. And why is there that funding? Number one, because there are all kinds of costs associated with being a victim of a crime, from hospital, care to job loss to even burial expenses. But right now in the state of New York, in order to qualify for that particular funding, you have to actually have a police report. You have to cooperate with law enforcement. You have to report that this crime occurred to law enforcement. And what that means is the majority of individuals who are actually collecting this funding are generally white women. And for the most part, Black and brown folks who do not necessarily feel comfortable reporting to law enforcement, whether they've been engaged in the criminal justice system themselves, end up not being able to qualify for this funding. And as we've just talked about in terms of this cycle of violence that communities of color are experiencing, that is a one way to remedy and stop the cycle, is to ensure that there is compensation for that victimization and that crime that has occurred. And so what we're trying to do is amend the law so that there will be new legislation that will allow individuals to pursue different avenues to create essentially evidence that they have experienced victimization of a crime. Doesn't preclude individuals from using a police report for this evidence, doesn't preclude individuals from cooperating with law enforcement, but it does allow someone, for example, potentially a CVI group, right? If you're the intake worker and you have documented that this crime has occurred and there's an attestation and affidavit along with that, that could essentially be enough evidence to be able to qualify for victims' compensation from the state. And so that is something that we're working on too. I will happily send out all of our attendees and our panelists more information about these campaigns. And we're at 1:15. I want to respect our panelists' time. I do very much appreciate everyone being on here. I encourage you all to reach out and to ask more questions. And a special thanks to our panelists for taking the time today from your otherwise extremely busy, extremely strenuous jobs. So thank you for coming and join us again soon. Have a great day.
Thank you.
Thank you so much.
Thank you.